Thank you. So as I said, I'm grateful for the invitation to participate in this forum. I'm looking at the traditional vegetables as sustainable food supplements for the vulnerable in the community. What we need to know is, so slide 3, please. What we need to know is that you are what you eat. If you feed yourself with most of the junk, like the person on the left, basically you remain vulnerable to quite a number of attacks. When you look at the kind of food you eat and you watch on your diet, it has been known that you become more healthier when you feed properly. And for that reason, we are now saying that it's important that we look into the most of the populace who are poor. They may not achieve food supplements that we probably may get from upper markets, but there is a lot of food nutrients that are recommendable among the even that can be accessed by the poor, especially from the agricultural side. I come from a country that we basically grow most of the crops around, but there are some vegetables that are actually neglected. And among them of importance today, they are very suitable food supplements as we are going to look at. Slide 3. Move, please. Slide 4.
Yeah.
So indigenous leafy vegetables are neglected in African culture because when people go to stay in town, they think that probably buying things from the mall and buying food from the upper market, which are processed, has a sense of affluence. And that has led to a lot of health-related problems, especially among for the children who are fed on junks. Now, when you come to the village, the rural poor, they are accessible to a lot of leafy vegetables that probably people may not pay a good attention to. One of those foods are things like stinging nettle, among others. These kind of vegetables are rich in vitamin A and C and a number of other nutrients. So it's imperative that we go back to the roots and look at this very important food segment in the society. We are therefore looking and advocating. In fact, as we have started a whole program at the university to look into food supplements emanating from the locals, the indigenous foods. Before people thought of some of the vegetables coming from other countries whom probably they thought are more affluent. So we are focusing on developing a whole area, a whole study area in the food supplements from the rural settings where we have the most majority. And we're also trying to say that some of them, as I have indicated there, things like the spinach, the amaranth, and those others, and even the most one which is coming up, the chia, has been known to have very important nutrients. In fact, even the chia oils have omega-3, and which are very important for the growing children. Slide 4. The next slide, please. Next slide. Okay. So now, one of the things that we noted in the course of our work, we have realized that there is the socioeconomic changes which have given people some lifestyle and stereotypes. In this case, people value kind of what you could call foreign foods, and because they look at them as stylish, look at them as a bit of more affluent in the setting, and because of that, we have neglected our traditional leafy foods. So we are trying to come up with an important paradigm shift and refocus on the roots, because most of these lifestyle diseases, most of these diseases are food related. when you eat healthy, you are expected to live healthy. And if you eat junk, then you're expected to destroy part of your body systems. And at the end of the day, what you're feeding in the system is the one that causes the diseases that we are having across. So we are saying that we refocus mostly in our traditional leafy vegetables, so that and there are others which appear wild, like for example, stinging nettle. Stinging nettle in our language here, it has not been explored. But when we did the analysis of the stinging nettle, we realized it even has iron, it has zinc, very high levels of zinc, which are important for body immune system. So it is imperative that we educate our people to go back and recheck on how we can use these vegetables as food supplements. Next slide. Now, next slide, please. All right, next slide. So how do we formulate this? We have realized that when you go through this field and you sample quite a number of them, you bring them together. The child or most of the persons that could have suffered some of these nutritional related diseases or body immune system that are dependent on how you feed will then be able to get a boost. And that's why we are saying that if you mix some of this, if you mix some of these foods together, you are actually coming up with a formulation that will be suitable for the growth of the majority. And some of the diseases like kwashiorkor, anemia, and the rest of other diseases will basically be handled. And these are foods that can be accessible by the majority of the poor people, especially living in the villages, so long as they have a place where they can do a little bit of farming. And even those ones who are living in towns, they should be able to do like what we had in the first presentation, the rooftop farming, where they can easily grow some of these vegetables for use. And we therefore advocate that the inclusion in this among the food supplements is an effort towards zero hunger, and also towards malnutrition, towards healthy living. It is an effort to betterment of the people, of the majority of the people in the rural lives, who may not have a lot of money to buy mostly processed supplements. These are indigenous, and these are more healthier than the processed foods that we get in the market. Next slide, please. So in my conclusion, therefore, and recommendation, we expect that most of these foods leafy vegetables which are domesticated should be able to play an important role in the livelihoods of the majority of the populace, and therefore it could therefore be a helping stone for the poorer households who are mostly vulnerable. And we are expecting that if these are included as an important core area for food supplements, then lifestyle diseases and food-related diseases among the vulnerable population, especially the children, the pregnant mothers, and the elderly, will be a thing of the past. So it's important we relook into these areas so that we uplift our people. And I think to that end, with challenging technology, I think I should be grateful that we have reached this far. Thank you so much. And bye.